Clifford Beers suffered his first episode of what we now call bipolar disorder, which is also called manic depressive illness, following the illness and death of his brother. So he had a trauma. Many times trauma can initiate a mental health condition. By the way, the new percentage is 80% of us will have a diagnosable mental health condition. 80% of us at one point or another in our lifetime. 80% of us. A diagnosable one. That doesn't mean that it's severe mental illness or that it continues, but any one of us, 8 out of 10, are going to have issues related to anxiety, issues related to depression. A lot of times those issues come around because of trauma, because of death, because of other issues. And Reverend Washington and I were talking before the service about how the minute you start talking about mental health issues, people want to leave for the door. They want to leave. They don't want to talk about it. I did a presentation on depression out at the YMCA, and it was a lunch and learn. I even brought free lunch. I had 20 or 30 people show up for the free lunch, and as soon as I started talking about depression, about 15 of them walked out the door. Yeah, people don't want to talk about it. Not even if you give them free lunch. People don't want to talk about mental health and mental illness. It's still a fear. It's still a fear. There's still a lot of stigma that's attached to this. So in the throes of his illness, Beers attempted to take his own life by jumping out of a third-story window, but he survived. And as a result, he ended up in public and private hospitals for the next 3 years of his life. It's what you call the mental asylums during that time. There really wasn't a lot of medication or treatment for people with mental illness. And so people really basically got locked away. Mm-hmm. So while in these institutions, Clifford Beers learned firsthand about the deficiencies of that system and the cruel and inhumane treatment people with mental illness received. He witnessed this himself when he was placed in a straitjacket for 21 consecutive nights. So upon his release, Beers was resolved to expose the mistreatment of people with mental illness and to reform care. So the Mental Health Association was founded to be a disruption. It was really founded to place judgment on a society that would treat people this way. And when he came out, he started the Mental Health Organization and with the following goals. He wanted to improve attitudes about mental illness and the mentally ill, to improve services for people with mental illness, and to work for the prevention of mental illnesses and the promotion of mental health. This was in 1909. What's interesting to me is the American Cancer Society was founded around the same time, and they had almost the same mission objectives. And think about that. The American Cancer Society was founded to educate doctors about the signs of cancer, because doctors were not even looking out for the signs of cancer because they felt like if they saw it, it was an instant death sentence. Nobody talked about cancer. There was as much stigma about cancer as there was about mental illness. There was as much fear about cancer as there was about mental illness. And so we think about the last 100 years, think about the progression of cancer. What's different? What's different about cancer now? I mean, we could say rationally we know a lot more about cancer, but the fact is medical researchers do, but we don't. Right? I mean, I wouldn't be able to tell you the mechanism of how a cell becomes cancerous or what the prognosis is of someone who has stage 1 or stage 2 or stage 3. I don't have the medical expertise. My rational senses can't tell me why cancer has come such a long way and mental health is still kind of back in the dark ages, right? But we treat cancer now as a chronic manageable disease, don't we?
That's right.
So if you hear somebody has cancer, it's not good news, but you feel at least that person has a chance, right?
That's right.
And because you know people who are cancer survivors, And they're doing well, and they're recovered, and they're recovering, and they're surviving. Because you see that and you've experienced that, then cancer has less fear attached to it. There's less stigma attached to it. I heard once that sunlight is the best disinfectant. And what that means to me is that when we keep these things in the shadows, when we don't talk about them, when we don't know people, when we don't talk about those things, we perpetuate that stigma. When we think of stigma, the Greek and Latin stigma was a mark or a brand. So a stigma marked a person as inferior. So when the plural form of stigma is used, it's that word stigmata, which I think is really interesting. Because stigmata is used as the nail wounds in Christ's hands and feet. When we started using stigma in English, it usually meant the kind of mark or stain that you can't actually see. So today we hear about the stigma of homelessness, the stigma of being overweight, the stigma of mental illness. It's an internalized stigma. This is what happens. This is how dangerous stigma can be, is because as these fearful habits create a society that leaves people out, they begin to internalize the stigma themselves and feel like they're less than, that they're not important, that they're not valued.